to case investigation interview basics. And learning objectives for today. By the end of the session, we hope you'll be able to describe the key roles and responsibility of the case investigator, understand the first 4 introductory components of the case investigation interview, and explain why it's important to ask about health history as well as symptoms and activities. And we are recording the session, and the slides are on the Google Classroom, just as a FYI. So I'm going to hand it over to Dr. Mike Reed to get into some of these basics and talk about why what you are doing matters.
Thanks, Laura. Just checking you can hear me okay?
Yeah,
Great.
Sounds great.
So let me just start by echoing Laura's gratitude for having us here and hosting us on your beautiful island. It's lovely to be with you this morning. And I have the sort of privilege of being able to kick off this session by highlighting why this work is so important. But let me sort of step back and help everybody to understand the key roles of contact tracing and case investigation. So at this point in the epidemic, we don't have a vaccine. We have a few treatments available, but those treatments, remdesivir and steroids, have really only a marginal role in supporting the sickest people that are in the hospital. So how else are we, able to prevent the spread of this devastating pandemic? Well, clearly wearing masks, socially distancing, these are things that we know work. And then the other thing that we know works based on a weight of evidence is case investigation and contact tracing. And so the role of the case investigation is really to reach out to every individual who's been diagnosed with COVID-19 and do a few things. First of all, check in on their welfare. Secondly, help them understand the need to isolate. And we'll come back to this later because we know that those individuals that are suffering from COVID-19 are the ones that are most likely to spread it. And then this third piece is determining who their contacts are and where they've been, whilst they've had symptoms, to really assess, how the disease may have spread amongst their network of friends and contacts. And by identifying their contacts and reaching out to their contacts and helping their contacts understand their need to quarantine, we can then prevent the onward spread of this disease. So case investigation and contact tracing are critical to prevent the chains of ongoing transmission. Next slide. So in terms of the roles and responsibilities for the case investigator, the primary role of the case investigator is to reach out to the individual who's infected with COVID-19. We use this term case to refer to those individuals, confirm that they are in fact infected with COVID-19 based on laboratory data, and then find out from them who their close contacts are. And we're most interested in this period of time during when the risk of transmission is greatest. And so we specifically ask about close contacts that have come into contact with that case during the period of time while they had symptoms, and then for 2 days before the onset of symptoms. That period of time, 2 days before the onset of symptoms, up until when they went into isolation, is sometimes referred to as the contact elicitation window. In addition, the role of the case investigator is to educate those individuals about the importance of isolation, staying at home. And then, because we know that it's hard to ask anybody to isolate, a key role is to link those individuals to the resources that will enable them to be successful in isolating. So if you get on the phone with somebody and you identify that they have COVID and you're asking them to isolate for 10 days, it's important that you also appreciate whether they're able to successfully do that. Do they have enough food at home? but they have access to their prescription medications so that they don't need to leave the house again. And that's a key part of what the case investigator will also do. In addition, and most importantly, sometimes a case has been in a situation where they may expose multiple people. For example, they went to church whilst they had symptoms, they sat next to somebody whilst they were coughing and sneezing, and this may lead to a suspicion for an outbreak in that venue. And the role of the case investigator may be to determine if there has been an outbreak where there's more than one case in a particular place. And again, we'll circle back to this slightly later. All of that information about cases and contacts, all of that information that you're collecting in the process will be captured. You know, you may be using an online database or a software solution in order to capture that information. But that way, that information can all be tracked and recorded by the Department of Public Health. Next slide. So, you know, just figuratively, this is what the sort of the continuum of steps looks like. So, you know, if you're the case investigator, you reach out to the case, and then in that process, you will then determine who their contacts are. And to sort of, you know, make this as sort of concrete as possible, you know, you'll possibly be on the phone and you'll ask, you know, well, who did you have close contact with? Who were you in contact with as long as you had symptoms? And actually, if you can cast your mind back 2 days before the onset of symptoms, who did you have contact with? And the person on the phone may well ask you, well, what do you mean by contact? And specifically, and this is the CDC guidance around what a close contact is defined as, it's anybody that that case spent more than 15 minutes of time with in close proximity, defined as less than 6 feet. So less than 6 feet, more than 15 minutes. In addition, anybody that was sneezed on or exposed to snot from that case, who kissed that individual or shared kitchen utensils with that individual. We also automatically define all household contacts as close contacts. So, you know, if you live in the same house as the individual who's confirmed to be a case, then that person also meets the definition of close contact. Similarly with sexual partners. One last thing I would say here, and it's a little bit of nuance, but it's worth bearing in mind, that 15 minutes is cumulative rather than consecutive. So for example, you know, if you got picked up by your neighbor and you drove together to work and you were in the car together for 10 minutes, and then your neighbor picked you up at the end of the day and you drove back home again, and that was another 10 minutes, and it turns out that the neighbor had COVID, well, you could say, well, I didn't ever spend more than 10 minutes in close proximity with that individual. But actually, over the course of 24 hours, that 20 minutes does meet the criteria for close contact. So I hope that makes sense. So the first step, as is illustrated here, is in the process of interviewing the case to identify who the close contacts are. Next slide. And then the next step is to reach out to those close contacts. And to determine, you know, first of all, whether those close contacts have symptoms, inform them of the fact that they're a close contact, and then help them understand the importance of quarantine. That step, reaching out to contacts, is what we typically think of as the role of the contact tracer. But you may well be asked to do both roles, and we don't quite know what the situation is at the Department of Public Health in Guam. But our suspicion is that, you know, the folks that are doing contact tracing may well also be doing case investigation. So in many respects, that's a sort of a logical evolution of the same interview. So if you reach out to a case and it turns out that it's somebody working in one of the local hotels, you know, you may determine that she has several household members that are her close contacts. Well, in some circumstances, you may ask those close contacts to be reached by a contact tracer, but you could also subsequently reach out to those individuals yourself and fulfill the role of the contact tracer. In San Francisco, we have separate roles for the contact tracer and the case investigator, but that may not be the case in Guam. You may be asked to do both, and that will be up to the Department of Public Health. So those are the simple steps. Yeah, and I hear from Yvette, some case investigators are also doing contact tracing. And then you also have some that are just doing the work of contact tracing. So it sounds like a mixture here. The other piece of this sort of workflow that is important to highlight is the role of a clinician. And it may well be that you get on the phone with a case and it turns out they're really not well at all, or you're worried about their the fact that they're coughing a lot, and you want to get advice. And so, as is illustrated here, you can also reach out to a clinician. And again, there should be clinicians that you'll be able to connect with at the Department of Public Health who can give you advice on what would the next steps be for that individual in terms of accessing further care. Moreover, there are often technical questions, and we'll come back to this later. How do you refer somebody to an isolation hotel? If there is food resources available, what's the next steps to accessing those food resources? And the team lead or the team supervisor is often the person that can provide you with those kind of specific technical questions. Okay, next slide. So just to review all of these separate steps, so that the case is the individual who has been diagnosed with COVID-19, and sometimes we think of the case as if you don't have a laboratory confirmed diagnosis but a strong suspicion, they're sometimes referred to as a person under investigation, or PUI. But more often than not, the case is somebody who has confirmed COVID based on a lab result. The close contact is anybody who's come into close proximity with that individual, either a household contact or somebody that has spent more than 15 minutes in close proximity, less than 6 feet, with that individual during the period of time when that case had symptoms and for 24 hours before the onset of symptoms. We'll come back to this later, but we ask the cases to isolate. If they are confirmed to have COVID-19, we ask them to isolate in a space that will prevent them from transmitting the virus to their close contacts, work colleagues, etc. And then we ask the contacts, those individuals that haven't been confirmed to have COVID, but may well go on to develop COVID based on their close proximity with a case, we ask them to quarantine. And we specifically ask them to do that for a 14-day period, as was explained in the slides yesterday. The infectious period, the last box here, is the period of time during which the individual with COVID-19 is potentially infectious to their close contacts. As I mentioned before, that infectious period includes a period of time 48 hours before the onset of symptoms, and then for as long thereafter until the case is able to isolate. I think I'll pause there. If there are any questions, I'm happy to try and answer them. One question I see from Miriam is there an overlapping responsibility from the case investigator and contact tracer? Well, yes. There are certain functions that are the same. Both roles involve reaching out to individuals. But if you're reaching out to the case, then one of the things you're going to ask them is, who have they come into contact with, since the time where they develop symptoms and 48 hours before the onset of symptoms, and are they able to isolate? And we'll go into details on what isolation involves a bit later. When you're reaching out to the contact, again, it's a similar kind of interview. You will ask them, do they have symptoms? Are they, are they unwell? But if they're not, if they have no symptoms, then the assumption is, well, maybe they have not developed COVID, or at least have not developed COVID yet, but they need to quarantine because they could develop COVID during the next 14 days. And so if they're going to quarantine, are they able to quarantine, and do they need resources to do that? And again, we'll help you understand that distinction between quarantine and isolation a little later. Great. Well, Laura, do you want to advance to the next slide, and over to you?
Yeah, thanks so much, Mike. And just highlighting, the importance of these definitions. If you're someone that likes to print things, this is one of the key things to keep printed, I think, because it can always get confusing. So just to highlight, knowing those key definitions. So I'm going to go into the case investigation interview that we're going to jump into practice very soon. And so just laying out the steps here in these 8 basic components that are all laid out for you in a script. We have a script that we will use for practice that is generic. It has not yet been tailored to be specific to Guam, but it contains all of these key components, and these first green boxes are what we're going to focus on today, really just focusing on introducing the call, explaining why you're calling, explaining information about COVID-19, really being able to support and establish a rapport with the case that you're calling and assure them that you're there for support, as well as gathering demographic and medical information. The other steps that we will review and practice tomorrow are more details for home isolation instructions, to make sure that people are able to isolate at home, the contact elicitation process, and locating information about any activities during the infectious or contagious period, as well as any assessment or referrals. And of course, the conclusion, always emphasizing, the support and importance of isolation. I'm seeing a question. Is there ever a case and contact call conducted as one when both are in the same household? Generally, you would still go through 2 different scripts. If you were first talking with the case, you will go through this script of the case investigation interview. And with eliciting the contacts, for example, if you're talking to someone and then they tell you that their partner is one of their contacts and that their partner is in the household with them, then the next step would be the contact call that has a different script to focus on quarantine, as the objectives are a little bit different. So in some cases, there's 2 different teams. So the case investigator would make the call and then a different team would call back the contact. In other cases, if you're doing both roles, you might call that person back directly or maybe even just conduct that call on the line. But we want to emphasize confidentiality. So even there could be some households where even if they have household contacts, they would not want that person in their household to know it was them. So case by case, and generally, it is a separate process as we're collecting the information on a case and then a contact in 2 different scripts and entering data separately. Okay, so this introduction, we really can't emphasize enough how important it is. If you think about if you answer the phone from someone that you don't know, are you even going to, give them the time of day to talk to them? You really want to, introduce yourself well and explain that you're calling from either the Department of Public Health or whoever you might be representing in this case, and confirm that you're speaking to the right person by verifying their date of birth and address, really emphasizing the privacy and the confidentiality of the call. In this introduction as well, you will do the notification of a positive COVID-19 test result. In some cases, this might be the first time where people are hearing that. In other cases, they may have already been notified by their provider or their lab. So in the case that it's the first time, there's obviously a lot of support necessary as people may react with fear and emotions. So that's really, finding a way to connect in this introductory portion is really important for the success of the call. So this is what we'll be practicing today. And ensuring, do they have time to talk with you? These calls are generally not, 5 or 10 minutes. They can go up to 30 minutes if they're, eliciting a lot of contacts and giving a lot of guidance. So you want to make sure it's a good time for someone, or see if there's a better time to call back. Okay. Then you want to provide information on COVID-19, and using an ask, tell, ask approach to see what do people already know. It's, most people, especially if they've already been tested, probably have a general idea of some of the basics of COVID-19, but you want to answer any of their questions and reinforce all of, the key information about symptoms, isolation, and also clarify if the case has already spoken to their doctor or nurse about their test result. As most of us as case investigators are not clinical medical professionals, we want to make sure that those who are sick do check in with their provider as well. So then you want to, really explain the objectives of the call. And it's really two key parts. One is to ensure support. We want to check in and make sure that people are able to safely isolate. And if not, provide them with resources to help them do so. And then secondly, we want to identify those close contacts so that we can notify them as quickly as possible to break that chain of transmission, to get those contacts tested and beginning quarantine and monitoring for symptoms. So it's really those two key points that you want to emphasize when explaining what you're going to be doing in the call. And so then you'll go into a series of questions that, can be a lot, basically the demographic and medical information. So I really want you to understand the why we are asking, so many questions, as you're able to explain to people can, ensure that they're giving you accurate information. Why do we want demographic information? As an island of Guam, there's situation reports coming out. We really want to be able to evaluate and track who is being infected, where are they, to help the Department of Public Health control and contain with improved strategies. So it's really just understanding the epidemic is why we want to know information about people. We also want to understand their health history. Certain medical conditions can put people at higher risk. So if you want to go ahead and put in the chat any of those certain conditions that you think put people at higher risk, feel free to type those in the chat. Who might be at higher risk. Yes, people over age 65, definitely. Higher risk for severe illness, definitely compromised, those who have a compromised immune system. Great. Yes, over 60 or 65. People with pre-existing health conditions. Yeah, exactly. Those who have previously had, cancer or other medical conditions, exactly, diabetes. We want to make sure we know that information. We also want to know, yes, heart disease, lung disease, any of these. We also want to know symptom history. And this is important, as we've mentioned, in this contact elicitation window, which we'll go into more details tomorrow. But that really helps us determine the infectious, contagious period to determine when we should elicit the contacts to know when the virus may have been able to be transmitted. So yeah, medical condition, symptom history, we will get into that in our practice today.